Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of genitourinary tuberculosis. In the clinical features, the earliest symptom of tuberculosis is urinary frequency. There is increased urinary frequency will be seen, and then this is the earliest symptom is urinary frequency. There will be presence of active tuberculosis may be present elsewhere in the body. It is found in less than half of the patients with genitourinary tuberculosis. In less than half of the patients with genitourinary tuberculosis less than half of the patients of genitourinary tuberculosis are associated with a disease elsewhere, are associated with a primary disease. Then in tuberculosis of epididymis, you will see that the abscess may drain through the scrotal wall. So if tuberculosis will affect the epididymis, okay, in the epididymis, if it affects the epididymis, then there is abscess will be there, and this abscess will drain through the scrotal wall and it can be seen outside. So any chronic draining sinus can be regarded as a tubercular sinus unless proved otherwise. So these are the main clinical features.
thank you and thank you for watching.